Good afternoon. I'm Tom Birchfield, and I'd like to talk to you a little bit this afternoon about the cultural and mental health assessment of African American males who present with major depressive disorder. What we'll talk about this afternoon is we'll get a brief introduction into how African American males present with major depressive disorder, some of the disparities they face, analysis of some of the data, and a summarization moving forward. So major depressive disorder is one of the most common mental illnesses within the African American male population, although they are diagnosed at a much lower rate than white males are. African American males tend to have a more prominent presentation of symptoms. They also tend to seek services at a much lower rate than do white males. Mental health, as it stands as a whole in the community, is a taboo subject, but it is a much more taboo issue in the African American male population. And part of this may be due to what Dr. Neighbors identifies as the tough guy syndrome. The tough guy syndrome is when an individual reports out as doing good or everything's fine, when in reality they're struggling with some type of health or mental health issue. They will present this way both to treatment providers and within their peer group. Here is a little chart just to get some kind of tangible idea of what this population size is. Of the entire population of the United States, 13.4% of that population reports that they are either Black or African American. Of that 13.4% of the entire population of the nation, 16%, or just over that 16%, reported having a mental illness within the past year. That equates to just over 7 million people, which in turn would be greater than the populations of Chicago, Houston, and Philadelphia combined. This information here is from the Mental Health America 2023. So some of the disparities that are faced by the African American male population when it comes to mental health and mental health treatment is historical dehumanization by medical personnel. This began as did slavery early in the inception of our country. Medical providers believing that African Americans did not hold the same worth as Caucasians or whites, performed horrific medical experiments on them. This was echoed again throughout history, with the most recent situation spanning from the late 1930s into the early 1970s with the Tuskegee experiment, where African American males were injected with syphilis and monitored over time. Historical atrocities such as police brutality play a factor as these stressors result in signs or symptoms of mental health issues. The stigmatization of mental health and mental health treatment, both in the community as a whole, but again, as it is amplified in the African American community. And then the cultural incompetence of treatment providers, as personal bias play into the inability to adjust the assessment process or assessment tools to include culturally or ethically or ethnically um, information to aid in the proper diagnosis within the African American male population. So we're going to analyze some of the historical factors again with slavery, police brutality throughout the timeline, although it seems more prevalent now as the ability to film or photograph has become easier on a personal level. The stigma associated with mental health care and mental health in itself, and the care and treatment of mental health, and how that's amplified again within the African American community. The need for culturally responsive treatment. These would be providers who provide proper assessment tools, which include the culturally responsive materials, allowing the African American population to self-report in a manner that's comfortable to them. And then misdiagnoses. Oftentimes, African American males present with a much more somatic type symptoms, even though it is a mental health issue. They will often report stomach aches, back aches, muscle aches associated with depression or major depressive disorder, which oftentimes results in a misdiagnosis. African American males are also misdiagnosed most frequently with schizophrenia, uh, not allowing for proper treatment and care of their mental illness. To move away from some of the culturally inept treatment, it is important to identify current supports within the African American community. Oftentimes, these begin with religious organizations, churches, and outreaches, community outreach. Another big support within the African American male community is the barbershop networking that happens in the neighborhoods. Clinicians should consider the cultural factors when diagnosing individuals, allowing the ability to remove personal bias from the assessment process. There should also be consideration to the social justice implications, as we've seen earlier, the Black or African American population is identified around 14% of the nation, with nearly 40% of the population of jails and prisons being Black or African American. And Blacks or African American males who present with mental health issues are oftentimes incarcerated at a higher rate than are white individuals presenting with similar symptoms. And then taking into account the limited amount of existing providers within the African American community, if you would just, try to imagine the percentage of the total population of the United States who are actually medical providers or mental health care providers, and then imagine a very much smaller percentage, about 4% of the total healthcare provider community being African American, definitely removes the ability for the majority of the African American population to seek treatment by a provider who fits into their demographic. Thank you for your time this afternoon. I appreciate it, and I will proceed to my reference slide. Thanks again. Have a good evening.